So you can start from point 1.
Today we're going to learn about lateral canthoplasty. Even among plastic surgeons, there are still differing opinions about this surgery. Some say it's a procedure that can be done, while others insist it shouldn't be performed. However, most are gradually coming to agree that it's better to perform the surgery when necessary. So I also don't think that everyone should get lateral canthoplasty. However, there are definitely people who really need it. So today, if you do need lateral canthoplasty, I'll talk about the type of person who absolutely should get it. I'll be discussing just one specific case. First, let's look at eyes where the outer corners are turned upwards like this. What you need to pay attention to here is, to exaggerate a bit, cases where the pupil is positioned all the way to the outer edge. You might wonder if anyone actually has eyes like this, but there are some people who do. So, there are people whose ratio of the white of the eye on the inner nose side and the outer side, relative to the black pupil, is completely unbalanced. When this happens, the eyes look like they're completely pushed outward. This can look very awkward and even a bit fierce. So in these cases, I strongly recommend lateral canthoplasty, outer corner eye surgery. Now, if you're going to have lateral canthoplasty, it's also important to consider which method to use. There are mainly two types of lateral canthoplasty methods. There is a bone around the eyeball here. So, one method is to pull the periosteum and the ligament at the outer corner of the eye. This is basically a simple pulling technique. The other method is to actually cut the ligament at the outer corner of the eye to widen it. This is called the tearing method. So, in cases like this, which of the two surgeries should be performed? In this case, it's the latter. The tearing method does have the drawback of slightly altering the normal anatomical structure, but in this situation, there really isn't any other option. In such cases, achieving the best possible cosmetic result through surgery is the most important thing. Of course, even when performing the surgery this way, we still do our best to maintain structural stability. It's absolutely not about completely collapsing the back part or anything like that. However, simply using the first method, where you pull the ligament toward the periosteum here, has significant limitations. It doesn't improve much, and as it reverts, it ends up looking like this again. If the ligament in the eye is relatively loose, and the distance to the bone at the back isn't that wide, in other words, if it's not too severe, then the first method can be sufficient. However, in cases like this, you absolutely have to use the second method, the one where you split it, for the surgery. And additionally, in these cases, combining it with a lower canthoplasty works really well, because the outer corner of the eye is raised like this. If you lower the raised corner, you can increase the amount of white showing on the outer side of the eye. It also makes your expression look softer and further maximizes the effect of the lateral canthoplasty. So for eyes like these, you need to correct them as much as possible using the tearing method and lower canthoplasty. One thing to be careful about with these eyes is that sometimes there is a slight epicanthal fold. In such cases, if you just open up the epicanthal fold like this, it can actually make the eyes look even more pulled outward. So in these cases, even if there is a partial epicanthal fold, I recommend not opening it up. On the other hand, let me talk about the opposite case. For example, there are eyes like this, but sometimes the pupil is positioned like this. You might wonder where such cases exist, but they actually do. In these cases, it's actually better to perform an epicanthoplasty, inner corner surgery, and you definitely shouldn't do an outer corner surgery in this situation. If you do that, the eyes will look even more crowded toward the inner side, which can make them appear cross-eyed. So, you should proceed with the surgery according to each individual case. That's the way to look at it. So, if you look in the mirror and notice that your pupils, your black irises, seem to be crowded toward the outer side and your eyes look a bit awkward, I would recommend getting outer corner and lower eyelid surgery.
But what if, like in the examples above or below, the eyes are crowded to one side? What should you do if there isn't enough space?
Of course, that kind of situation can also happen. So the effectiveness of the surgery may be greater or less compared to others. For example, if the eyes are protruding, the effect can be greater than if they are completely sunken, and if the ligament is a bit softer and there's more space to the bone, the results can be more effective. But in these cases, honestly, you should try to achieve at least some effect. It really can make your expression look a bit fierce or give off an awkward impression. So in these situations, if there's absolutely no effect, you shouldn't do it, but if there's even a little bit of improvement, I think it's better to proceed and offer some help.
Gentle music starts playing softly in the background from point 1. At the very beginning.